you are not comfortable being recorded, you would need to drop off the.
Sorry, you want me to shut the door?
You would need to drop off the call, and we would provide you the information through a different format after the call, but we will be recording this. So I am just going to jump right in because I know everybody is very busy. Can somebody just keep admitting people? I don't know if, yeah, thank you, Joanna. I appreciate it. So
Welcome.
We called everybody together. We sent out an email, and this is a follow-up to the email. We're going to be looking at increasing our review of data and reporting that's done related to Medicaid administrative claiming. Medicaid administrative claiming is funding related to information and referral, which is SSBG Title 20 funding, and assessment and counseling. There are 3 buckets of money related to that particular category on the invoices, and 2 of them you can pull Medicaid administrative claiming from. And my understanding is that we have to show what we're doing in order to claim the funds. So we need to show what work is being done by staff for information and referral and assessment and counseling. And because we have to show the entirety of the money, there may be additional tracking or reporting that will be required. But at this point, all the reporting is something that I will be pulling with the staff person that we're adding to our team. And I'll be pulling information and referral only through Navigate. And then I'll also be pulling person-centered options counseling transactions, which is the data collection form. So the ask that we're making of people is that you make sure that staff are reporting all of their time for information and referral and person-centered options counseling, because this is what we're using to gain approval of the funding that we're currently claiming, and to potentially ask for more funding in the next contract cycle. As far as the person-centered counseling, that's the data collection form, but we're also asking if staff are traveling for an appointment, or if they're doing work for an appointment after they hang up with the client, that they add that time into Navigate, because the more time that they track, the more we can show the funding that we can justify through the actions that are being done. So that's my understanding of what we're doing. I don't know, Kyra or Lori or Wendy, I don't know if you want to weigh in at all.
I was going to let Wendy go first, but nope, that's about it. We just need to be mindful with supporting the Medicaid admin that we currently pay out of this contract set. And so we're trying to utilize the data that you guys are already entering in order to get to that end result. So, and then potentially be able to use that information in the future to make more informed funding decisions.
Thanks, Cara. Sorry, I couldn't find my unmute at the time. Sorry to join a little bit late, but I concur with what Kyra is speaking of. And then the only other thing that I think we haven't talked about, which may come up as a question, is the 2 eligibility coordinators that we pay for with the community partners contract. They're essentially, their job descriptions are 100% Medicaid work. And they get paid with the assessment and counseling money. So we want to maybe have a discussion about that offline to just make sure that we're documenting or collecting information about the activities for those 2 positions correctly. It was an afterthought after we had our meeting last week. So in anticipation of coming together with everybody today, I thought I would just put that out there. And if we have any follow-up from today's discussion when we're answering questions and things like that, we'll include that information.
Okay, so that's the gist of what we wanted to share. What questions Tammy?
I always have questions. You know that of me. So I heard you're pulling some data from the data collection form. How is the INR data going to be? How are you pulling that is what I'm curious. I want to make sure that we're grabbing the markers we need to, but how would you be pulling that information?
So we would take total contacts and subtract out the data collection forms because it's INR only. So it has to be INR that doesn't include person-centered counseling, also known as assessment and counseling. So we're subtracting out data collection forms, subtracting out any kind of like fillers like escape call or things that aren't actually calls that get recorded. So those two things will be filtered out, and we're taking the remainder as information and referral. It's not a perfect number, but it's as close as we can get without putting more of a burden on staff to be tracking their time. It's something I can do.
So Medicare numbers will be included in that. Caregiver contacts will be, oh no, caregiver.
That's
okay.
Those are separate grants.
Okay.
Thank you for the question.
Yep.
Other questions?
April has her hand up.
I
April.
guess mine is along the same lines as Tammy. I'm having trouble figuring out what you're counting as an information referral. So you're taking out Medicare calls, you're taking out family caregiver calls when you're looking at these total contacts.
Yeah,
So it's everything that doesn't have an additional marker or a DCF. That's what you're calling information and referral?
yes.
Okay.
Other questions? Tammy?
So is this effective immediately, or when are you expecting this to begin to occur? And is there any more information that we have to submit with our invoices?
So as far as when we're beginning, my understanding is we'll be pulling the data for November in December. That's right, Kyra, right?
Yeah, I think Lori may have to double check. We ended up kind of figuring we can't really go back and expect everyone to do things. So we were figuring for November 1st. We
Right.
would
So I'll pull November data in the beginning of December. So that's when we're starting. And my understanding is at this point, we're not requiring anything else to be included with the invoicing. April.
So I kind of looked through some of the materials that you sent before, and it talked about follow-up calls. I thought we had put the 90-day follow-up on hold. Should we resume that, or what is the?
We're not doing the 90-day follow-ups at this point. That was any interactions you have after you hang up with the client. So when you call the client back and say, did you get what you needed? Or if any follow-up to the initial appointment, but not the 90-day follow-up, that's separate.
Oh, I'm confused. I'm so sorry. So we should or should not be doing the 90-day follow-up and the
No.
DCF? Okay.
No, we're not doing the 90-day follow-up at this point.
Just as needed to make sure that, on a case-by-case basis. Okay.
Exactly.
But that is
Yep.
something in the future that can be part of this, or no?
We hadn't discussed that,
Okay.
so I'm not I don't see that as the same thing because this is the bucket of money related to information and referral and assessment and counseling, whereas the 90-day follow-up is for a different
Is the
program.
DCF.
Right, exactly. It's for a different program to basically justify something separate from invoicing. It's not related to invoicing.
Okay.
What other questions are there?
Amy, I have a question. I know you're collecting the data from the DCF form and you were saying that the rest minus Medicare, the caregiver program, going to be INR. What if we're using like the taxonomy of Medicaid information and counseling, which we sometimes do, if the person's calling us and asking us a Medicaid specific question, but it's really not options counseling? Are those going to get pulled in?
Those, if you do a data collection form, it's gonna count as person-centered counseling.
Right.
If you have,
Go ahead.
go ahead.
No, I was going to say, I get that piece, but there are some calls that are just a Medicaid related question that really
Right.
doesn't involve options counseling.
Right.
And
So if
we
you,
use that
so if you're
specifically.
not doing options counseling and you're not doing a data collection form, it would
Right.
count as information and referral because you're providing information.
Okay, regardless of whether it's Medicaid specific, it's just going to get pulled in under information and referral.
Yes.
Okay, okay.
Yeah, good question. Other questions? Cheryl.
Hey, Amy, it's Cheryl. I do have a question. So you're going to be collecting numbers. Are they going to be compared to what we bill for INR? Because like my staff punch in and out of what they're doing. I think all staff do that. So are you going to be looking at total time in Navigate compared to time billed to INR? Is that what is going to happen?
We are looking at total time in Navigate. Right now we're really just data collecting. We're just looking for information so we can determine how to handle it in the future. We really haven't, at this point, we're not comparing the data we pull from Navigate to the information in your invoices. Does that answer your question, Cheryl?
It does, Amy. Thank you.
Good. Okay. April.
Me again. Can you share the parameters that you use to pull this report so I can just check on how my site is doing and making sure that their time matches what you're pulling?
Yeah, sure. I
So
can send that
whatever
out
you
to
use
everybody.
in the query builder, yeah, that would be helpful. Thank you.
Yeah.
I just want to go back to the other piece. Sorry that we're going to do it here. I don't want us to go too far. Kyra, I thought we did want it to have to match the time. And I thought that one of our questions or one of the things, Amy, that you brought up was was it the callbacks or when they went out on the road and that your statement where that when they came back, they would have to input that because that's going to help tie all of the time together. Am I wrong? I just, because we've had some internal conversations, but I did think that this was going to have to match their time.
So my understanding was that we were trying to track information to determine whether what was being entered into Navigate actually matched what was in the invoice. So right now we're trying to make sure that that actually works before we start enforcing it.
Yeah, I thought we were allocating based on a client count. So we were getting the client, like that's part of what we're getting from the system is, or the contacts, not so much, I guess, because you could talk to the same person like 3 times. So I thought it was the contact that we were basing things on in order to do allocation. And then the time, we do need to be mindful of it's that certain grouping of, because right now we have 3 funding sources going into one pot, and we need to allocate that out a little bit better than we have been. That's part of our challenge we're trying to resolve. And what goes into that pot is our assessment and counseling, and then just kind of general service link, we call it. So I don't know how you guys code that on your time cards, but that's what we're kind of trying to tie back to and make that connection with this information in order for us to be able to allocate it out. So that's the end result we're going for, is that we need to split up that pool of time in a thoughtful, cost allocated way that we can support when audited by the federal government.
I just had a quick question. You just said INR, assessment and counseling, and then general service link. I'm just looking for differentiation between like INR and general service link, what that would be, because
Yeah.
I have no idea
So
what you're talking about.
I
right
don't
now.
even know what general service
Okay.
is. I look at it as a funding type. That's the way I'm looking at it. And I feel like, I don't know, Amy, maybe I feel like general service link ends up kind of being a catch-all maybe for some things as a result, because it's general funds. So we have a little more leniency with how we can work with what falls under the general funds pot versus the two others where it's SSBG and Medicaid admin.
Right now,
So-
you don't have to, it is, for us, it's kind of the funding stream, Tammy. It's, you don't see that. It's not broken out, which is where we're saying we have to be able to now break those out into those three entities, but it's still gonna be, right now, you see it as one budget. And so
Right.
it's just a different terminology that we use behind the scenes for us for what pays for that for you.
Right. And it's sort of labeled that way in the budget. So the INR is really Title 20 SSBG funds that we allocate. And so when you look at the broader spending plan for SSBG Title 20 money, Service Link is part of that spending plan for that federal money. And it's a mixture of general funds and federal funds because we have to match it. And it's just labeled INR. And so that's what we call it. The general funds is labeled Service Link, and the assessment and counseling money is, labeled assessment and counseling. And we're trying to do two things with pulling the reports. One is to justify the time spent for the funding sources that have Medicaid claiming in it. And then the other is to, behind the scenes, ensure that we're allocating the funding in the invoices based on the activity that we're seeing in the data as well, in order to save us from having to do separate budgets for all three funding sources. I'll just say that. We're trying to pull data that we have access to justify the allocation so we don't have to in the future ask for separate budgets. We want to keep it one budget and not have to change that for you.
So I'm just wondering how general service link activity would be. I'm just not wrapping my head around this. So I know how INR is going to be pulled. I know how person-centered, but general service link, I'm just curious how that's going to be pulled and differentiated within Navigate. So either it's INR or it's that no wrong door work. And how is that going to be determined is what I'm trying to wrap my head around.
So we're going to be very interested when we start seeing this data. And so we're trying to account for some unknowns that may happen where the Medicaid admin claiming is going to be very clear, and potentially we haven't even been allocating the right amount of Medicaid admin claiming to you in that pot of dollars. So what may end up happening is when we run out of that Medicaid admin claiming, just because that's the way the contract was done, because we just did it based on the way it was before, and we didn't have this information at the time, we would end up going into that other bucket potentially to cover some of the expenses. So we're trying to allow for the ability to pivot. as needed once we start seeing this data, because we haven't looked at it in this way. So we want to be able to adapt as needed. So that's why we're saying kind of general. You don't have to worry about like, oh, I'm going through my day, I need to mark my service link general admin task. Like, you don't have to worry about that right now, because we're trying to keep it general so we have that adaptability.
So I understand where you guys are going with this and why. I appreciate the multiple breakdown by both Ira and Wendy there. At first I was like, I'm very confused. So I understand where you guys are trying to go with it. My only I would just want to make sure that we don't have to go to charging my staff, charging their time by the hour for their work, because we do like an FTE base. We review it quarterly, make sure that it's a good reflection of their time. I wouldn't want to have to go to them having to document their day. They already have to document and navigate. They already have to document it, probably a couple other places as well. So that would be the only thing that I would want to try and steer towards. Probably my only comment.
Yeah, and that was our intention with this plan, because when we were talking about it, we're like, okay, we need this data to support these dollars that we're technically already drawing. But trying to get everyone to like monitor and document every minute, the juice isn't worth the squeeze in that situation. So we're trying to find that balance. And that's why we figured, that's why we figured we're going to try using these reports we already have and just remind everyone that like you need to be really diligent with your reporting, because now it has other ramifications of supporting this current funding that we're already drawing, and then getting a better picture of what we've been doing and how it potentially isn't even in the right pots, and what we can do to maybe fix that as we move forward. So
absolutely.
Yeah.
Hi, this is Cheryl. I'm a little confused because we had attempted to submit our information based on FTEs, and we were told we couldn't. We submit based on hours, and we get questioned on that, and our hours have to match what we've submitted. So can we bill on FTE?
They're still submitting timesheets. It's just how they've worked. Courtney, maybe you can answer. I mean, where's Courtney?
Yeah,
There she is.
Cheryl,
Everybody's
if you
jumping
wanna-
around. I'm like, where'd Courtney go? Sorry, they're still submitting timesheets is the bottom line, Cheryl.
Yeah, Cheryl, if you want to talk off
Yeah.
this meeting, I can talk to you about how we do that. We do it by FTE, but it comes out by hour.
I would love that. Thank you, Courtney.
Yeah, absolutely.
Jeannie.
Yeah, hi, thanks. I just wanted to piggyback on that, what Cheryl had said, because it sounds like it's a little bit off topic, but it sounds like there's some kind of allocation going on, and a formula, and we have our staff punching in and out, sometimes in 15-minute increments at this point. So I would also be very curious to see how that works for you, Courtney. And
I would
you know,
too, because we're doing
if you're
sometimes
being allowed to
15-minute
do that,
intervals. Yeah.
Anything to reduce the amount of punching in, punching out, et cetera, that our staff has to do, depending on funding stream, would be helpful.
Yeah, it's really difficult. I just put in the chat my email. So if anybody that wants to have some more information, just email me and I'll start like a big one and just share what we do.
And I'm assuming
We've always tried to work with what you guys have been using, though. I just want to say, we've worked with each of you individually to accommodate how you were marking your time or whatnot. It's not been so. I get confused on which group I've got here. We don't want to see an allocate. I mean, how you get to your time is how you get to your time. you know, and this is a very difficult way of doing, you know, you guys have the caveat with all of these different programs in one. But so it was just that we worked with everybody individually, and it's not that you can't, you know, we've always said if we get the timesheets the way we need to see them to accommodate the feds, then it's fine. And again, you all have different systems that you've worked with. So that's why it's just different in the way Courtney has, you know, worked out her system to how you guys have been doing your systems. So, it's not that anybody's, you know, if you find it easier, maybe you will, but it's not that anybody's doing it different. I'm getting my timesheets the way the feds need them from each one of you. And it just worked with your systems. Does Jean still have a question or follow? Okay.
Are there other questions or comments? Okay, I will put together a document of how to pull the numbers in the query builder. And I will follow up with the center managers about that reporting. And we can talk about how to just keep you informed of the numbers that I pull and make sure that we're matching up. But I just want to thank everybody for coming on the call, and I appreciate your time. It does take a while to turn these recorded videos into something that I can share, so I won't have this out immediately, but as soon as I can get this turned into a YouTube video, I'll send it out to everybody. So thank you very much for coming on the call. I really appreciate everybody's time.
Thank you, Amy.
Thank you.